Hi, and welcome to #Podblog. Today, we're talking shin splints. So many of you guys will be runners who are training for half marathons, triathlons, and basically one of the most common injuries we tend to see in our clinics is shin splints. So what is it? Shin splints is a generic term for pain in the shin. It doesn't really mean anything. There are various reasons why people suffer with pain in the shin, but shin splints is just a term given to generally all pain that's experienced in that area. Today, we're going to go into a little bit more information about the types of shin pain that lots of you runners out there experience, and hopefully give you a little bit of an insight into what it is and what you can do to help it disappear. So I think there are a couple really that seem to present themselves in our clinics.
It's probably the most common thing I've been seeing in clinics lately, especially in Cardiff, with the Cardiff Half Marathon being, is it 6 weeks out now?
6 or 7 weeks, I think, yeah.
Obviously, all our weekend warriors are trying to get the miles in as quick as possible and get up to that distance they want a few weeks out before they all reduce the running down a bit week before.
Me included.
Yeah.
Me included.
There's a few people in the clinic. Are you guys doing it? You're doing it? Tom, how's training going?
Not great at the minute, if I'm being honest. Yeah.
What's that, once a week?
Just got to up my game a little bit. I'm feeling the pressure, but yeah, I'll get there. My brother's also doing it, so I'd say between us, either we'll be there or I might pull a sickie.
So Tom would be the patient that I would call a weekend warrior. But you run on Thursday, but that's the only day you run on, isn't it?
No, well, more than that, less than that at the moment, I should say. I'm getting there. We'll get back into it.
Can we cover some of the facts that Tom is probably doing wrong in his training?
Yeah, well, use me as your example. Absolutely, why not? I think it's great if you can reference yourself in these situations.
I'm not just holding this orange leg up. We will be going through where you find the pain.
So, I think the most common one that I tend to come across in my clinics in particular is pain right in the sort of lower third of the inside of the tibia. So sort of really this region through here can be awful. It can be extremely painful to touch. So if you put your finger or your thumb in there, you'll experience quite a lot of discomfort. It tends to flare up during and after a run, and it's been known to be painful enough to stop people training. It's terrible. We often refer to this as medial tibial stress syndrome. Gareth, if you want to,
also known as MSTTS, isn't it?
MTSS.
SS, sorry, yes. Close, it's close. It's pretty much what we see. A lot of people explain that it doesn't come on instantly when they run. It's like a building process, so it's a few miles in or a few minutes in, and it gets progressively worse when more load or more running and more steps are put into the tissue.
I think for us, if we look at very simple anatomy, we're going to go, what is the most common muscle that creates this stress? And I think certainly from our point of view, it tends to be tibialis posterior. Might be nothing to you guys, but it's basically the muscle that runs very, very close to the shin bone, the tibia. Tracks right down very close to the lower third of the tibia, which is where most people experience their discomfort. Tracks right in across the ankle and attaches onto a bone called the navicular, which sits just above your arch. Basically, its job, if you can imagine, is to supinate the foot. So what does that mean? Basically, when we move, we certainly through a foot, we have a tendency to roll in, pronate, and roll out, supinate. And we should do both of those movements through any heel to toe progression. And this muscle in particular is responsible for rolling the foot back out again. It's very important towards the propulsive phase of the gait cycle. So I think going over the anatomy of that, it sits very close to the bone. It becomes overused. The tissue then becomes stressed, and actually because it sits so close to the bone, as it becomes inflamed and sort of, if you like, as it becomes less and less healthy, it starts to put increased stress on the inside of the shin, and certainly it starts then to present very much like a bony injury. So people don't often assume that it's a muscular related problem, but that it's actually very much a bony issue. And I think that really then we've got to look at this injury in a slightly different way. And I think if we're thinking about it as a muscle related injury as opposed to an out and out bony shock absorption issue, we have to look at how we treat that and how you guys can treat yourselves. And I think really what we should be discussing right now is how we reduce that muscular overuse, or how we then basically recondition that muscle in order to cope with increased load so we can get back to running.
The way a lot of the patients present it when they say, oh, when I run my finger up, it feels like bubble wrap. That's the type of sensation a lot of patients explain after running. It's quite painful, it's quite sore. You have radiating pain either at the bottom of the ankle or radiating up the leg. The things that I hear a lot of the common runners say, oh, I've changed my trainers, or I've increased my miles dramatically. And they're the type of things we're going to discuss now, how to try and bulletproof, really. It's just to help you out a few weeks out, just reduce the load through these tissues.
So running shoes, I think,
hot topic.
Yeah, very hot. Bit of a minefield. I think you'll speak to 10 different people, 10 different runners, 10 different podiatrists, and I think that we may all give you a different idea of what's a good shoe and what's a bad shoe. But it is very important, I think, to understand that running shoe has an influence over the load that goes up through your leg. And certainly from my point of view, with this type of injury, I think we should be looking at shoes that are a little bit more structured, so less flexible, less lightweight, and slightly more sort of firmer, structured footwear to give that foot basically a little bit of assistance, again moving towards the propulsive phase of the gait cycle. What about things like, I think one of the topics is how quickly people increase their load, I think.
So that's something that I like to listen to patients. I think I'd done a course a few weeks ago, the running rehab course, and I think we caught up the other day, me and Tom, we spoke about this, and it was quite interesting just to listen to a lot of other therapists. We all hear the same trends, and I think these are the type of questions you need to be asking yourself as athletes, and especially practitioners should be questioning you when you're going into their clinics. Personally, I think there's something we're following a lot in clinic now, is we're following that 10% rule. You increase your miles by 10% weekly, and then around about the 5th, 6th or 7th week, depending how many years you've been doing running, that's when you do your deload week. What I mean by a deload week is you do reduce the volume. That's not fully, so not like me, that'll take a week off, sit on the sofa, catch up with all my programs. It'll be dropping it by about, I'd like to say around 30%, maybe even lower. It depends on how aggressive or how much you can tolerate as an athlete. Obviously, something that I like to prescribe to a lot of my young or new runners is couch to 10k or couch to 5k. That's
absolutely.
A brilliant little program that will allow your tissue to adapt to the load. What I mean by load is hitting that road or the surface you're doing, allow your body to adapt slowly and reduce those chances. I'm not really, research lately says that 10% rule is the gold standard.
It's the gold, absolutely. It seems to be the place to go. I think, one of the most common causes of shin pain, I use it quite regularly with patients, is sort of New Year's resolution, January the 1st scenario, where everyone puts a bit of weight on over Christmas, and then that's it. They've made their resolution. They're going to absolutely hammer the training come the first week of January, and those loads go through the roof far too quickly for the muscles, the tendons to basically condition to, and that's when things start to break down. I'm a perfect example of somebody who's tried to push too quickly and ended up struggling as a result of it.
The bench press is always busy in around January. You struggled, don't you, Tom? Sorry. But it's something definitely gyms up and down the country you find in January. You have that massive influx
and it's the same with gyms, it's the same with running. Again, people are so quick to want to try and progress very quickly. We don't like to do things gently. We want to get there and we want to get there now. And I think that the body as amazing bit of machinery that the body actually is, it just can't cope with an increase that quick. And I think one of the key things that you should do, that I should do, that we should all do is, as Gareth just said, use the 10% rule to gradually increase your load over a period of weeks and weeks as opposed to days and days.
Progression is key.
Yeah, I think so. So we've talked about footwear, and we think that footwear definitely has an influence. People often ask us, what running shoes do you wear? And again, it's very much a personal choice. It's a personal preference, and I can't sit here and say that one running shoe is better than another, because everybody has their own opinion. It's a very personal opinion. I think comfort's very important, but I also think structure. If you go for a shoe that's too unstructured, I personally in my clinics see a higher prevalence of injury. So again, what sort of shoes are good? Things like Asics, Brooks, Mizuno, Saucony, I don't know.
There's a lot of range coming out now, and I'll jump on what Tom said there. I like something that's got a bit of cushioning as well. It's something that I've been trialing now with, I'm not a big runner, but with some events that I've put my name down to now, I've had to increase it quite slowly actually, and I've changed my trainers totally. I think I've gone for some maximum cushion now. Obviously I can't say it's massively helping me at the moment, but to be honest, I'm enjoying running them. I'm not getting banged up as quick. I find my tissue stress is better. Obviously, after my ankle injury as well, I think that extra cushion has helped me dramatically. We're all seeing our high volume runners wearing our, not to chuck brands out there, but Hawkers and all that for the longer distance. It's a little bit like it's gone full circle at the moment. If you go online and read all the blogs, everyone was going on about minimal this, minimal that, heel drop this.
It seems to be shifted back across.
It's a trend.
Some trainers, load and how quickly you increase the load. Obviously, from our point of view, we're looking at foot type, we're looking at things like pronation and supination. Now, both of these things are perfectly natural things to do. Pronation to roll in, supination to roll out. Both are very, very important for normal foot function. Don't get caught up in this whole thing that pronation is bad, because running magazines will constantly throw that information down your throat, and I don't think that it's at all accurate. I think we need to accept that pronation and supination need to happen. Both need to happen for normal foot function. But often for us, it's the timings associated with those movements. It's prolonged pronation, then leading possibly to an increased tendency to rely on the soft tissue. Things like the supinators within the foot, tibialis posterior, tibialis anterior, gastroxoleus. Working too hard, and again that's something that we look at pretty much day in, day out when we see somebody suffering with shin pain. The other question really I think people often ask is things like their running technique.
It's a big thing I see in clinic. I find personally, I think we spoke about it the other day, was step width is a big thing.
Yeah, stride width.
We're quite lucky in the clinics, especially in our Cardiff clinic with our 20 metre gate lab?
Yeah, 20 metre gate lab.
We can get people running, and I think as a practitioner that gives us really good feedback. Obviously we can use our force plate and all that, but we have a straight line that runs directly down the clinic, and you wouldn't believe when you just put an easy slow-mo app on them how narrow that step width is. Especially easy things you can look at: wedge your phone in the corner of the room or in your local track, get a slow-mo on you, look at that knee gap. So is there a gap between both your knees and where your stride width is? Because that's an easy quick fix just to reduce that load through those tissues, as well as surface areas. Obviously we're quite lucky, there's a load of tracks now that are available to have open run sessions. I recommend a lot of my road athletes who are getting a lot of symptoms to go down and change the surfaces up just to reduce that load through those tissues. And it's a bit of a trend coming now. We're talking about load a lot. I think more and more. I think it's something that we discuss. I think the days of stick a bit of wedging in under their foot and hope for the best, I think are long gone. I think we've got to look at load management and think about things, as Gareth said, about stride width, foot function, footwear, and I think there are certain things that
that once you get this problem, you need to become quite aware of, and that is you can't really just run through it. You need to make a change in order to break the cycle. So you should be looking at everything that we've discussed, and then I think there's probably some strengthening stuff that we can work on as well, maybe.
Yeah, there's obviously you've got to look at all tissue, you've got to look what is firing and what's not. I think the thing that jumps to mind with me now, and I'd like to use an example, I had a patient the other day, he was a postman. So by day he was racking up plenty of steps. We've all got Fitbits or Cool Watches, other brands available. You can monitor that, and what we found was when we looked at his day-to-day levels and we looked at his foot mechanics, walking around in his job, his running came along. It wasn't actually a running problem, it was actually managing his day-to-day activities.
I think so.
We see it a lot. Shoes.
Yeah, I think people have got such varied lives now. I mean, I don't do that much walking in my job. I sit behind a desk and I watch people walk for a living. That's what I do. But when somebody comes in experiencing pain, to just assume that they do the same thing as myself, I don't think is the right thing to do. People do have very active jobs, and I think you can't truly assess somebody from our point of view without sort of understanding what their day-to-day life entails. And as Gareth said, you can rack up, a couple of my patients tell me how they quite regularly rack up 20,000 steps a day in work, which just blew my mind, really. So you can imagine the level of fatigue and muscle activity that occurs through a day like that, in comparison to somebody like me who probably does more like 4,000 steps a day.
Can I just stop you there, Tom? Coming up to 8,000 just shows how much more work I do than you. Anyway.
I think he's cheating.
Might be shaking my hand a little bit. But yeah, that goes, obviously we're talking about tissues there. For me, an easy assessment you can do on the house to have a look if you've got poor range is maybe doing an E2 test. That's something we'll go over. We are going to be releasing a good few videos or some extra YouTube stuff on easy cues you can go and look at. Just look at your foot mechanics, and obviously
you've got your stretchy bands today. So
Tom's
what are we
booty
doing
band, as we call it. It's
so
a great little tool. You can do some tissue activation work before or after your training.
Yeah.
You can hit the smaller muscles specific to that foot and ankle as well. We'll be covering these in more depth now in the next few videos. But it is a very simple, something you can do when you're watching TV. It's not rocket science. I think
so. I think again, if you've got an injury, these bits of very simple kit can become quite handy for your rehabilitation. As Gareth said, sitting down on the sofa, using it to do a bit of resistance work, really trying to stimulate those muscles and get that recovery in place. Again, we're going to be going through this in a lot more depth with some very simple blog that you can access on our website, www.feetinmotion.co.uk. We'll also be doing some live Q&A sessions with Facebook Live. Keep an eye on our Facebook post at Ace Feet in Motion, because we will be giving you guys information about when these live Q&As will be happening, so that you can jump on and fire away, ask the questions that you as the person suffering with this injury really want to find out, and we'll do our best to answer it. I think that
supplements the blogs. The blogs aren't going to be able to carry on unless you give us content to work from. We can give you as much content as we want to give, but you've got to find some questions for this to be beneficial, I think. And that's the thing. I think we're going to get other people in as well to go about things in a different angle. I'm looking forward to some debates, to be honest with you.
Me too.
It'll be quite a good thing, I think.
Multiple sort of healthcare practitioners looking at it from different points of view, and I think as a whole what that'll do is it'll give us a much better overall picture of again, how we get you guys back to fit and healthy. Thanks for joining us.
We covered it all there, didn't we?